As fighting escalates in Sudan, community groups, websites, and apps have sprung into action to connect citizens with vital resources.
السودان وبدأت الحرب.
From his home in Saudi Arabia, web developer Freed Adel has turned his personal website into a platform where people can either request or offer assistance based on their location. He says when the conflict began, people did not know what to do and they started sharing what they needed on social media. He had the idea to group it all in one place. The conflict, which began on April 15th, has already killed hundreds of civilians and triggered a humanitarian crisis. To address supply shortages, 25-year-old Khartoum doctor Bakram Walid has built a 1,200-member-strong WhatsApp community where residents can share information about where to find essential goods. Walid said the item in highest demand has been clean drinking water, followed by medicines for chronic illnesses.
In each below like this community is like different groups depending on the area you live in. We don't have like money-wise or financial aid, but we're just trying to like ease the communication between people. So I'm trying to like link people together. So without even financial aid, you get me? So that's basically the idea.
Elsewhere in Canada, Ahmed Mujtaba is using his health app DoctorBase to help Sudanese people from afar. Most hospitals in Khartoum have been shut down amid the violence, with the few left open offering only limited services. Dozens of doctors from around the world have signed up to the app since the conflict began to advise patients in urgent need of medical help. But Mujtaba says the situation in Khartoum has become increasingly dire in recent days, and there's a limit to how much the app can do.
So I can't tell you the specific cases, but unfortunately, the last 2 days, we've seen like a couple of cases that they were urgent. They're not meant to be treated using telehealth, so they actually need to go to a hospital. We do let people know as soon as possible, and we also let them know before they start the visit, this is not meant for an urgent cases.